Hello. This presentation is designed to give you a little bit of background information prior to us meeting in the session on Tuesday. So it's just a little bit of background about why behaviour change is necessary and a brief introduction as to what behaviour change actually is. There will be other presentations following, just giving you a little bit more information. So what I wanted to start with is getting you to think of why changing behaviour is so important. And this really links to the health risks associated with unhealthy behaviours. And this includes obesity, cardiovascular disease, type 2 diabetes and cancer, and other health conditions as well. But also, of course, in the last couple of years, we've seen that all of those conditions make people at much greater risk of being severely ill or dying from COVID-19. So we've got all of those things to think about. Very worrying links happening there. So we know that many of the common health problems are related to unhealthy behaviours, and therefore us trying to change those interventions, trying to help people to change those unhealthy behaviours and replace them with healthier ones, has the potential to improve health and decrease healthcare costs significantly. That's a big part of what dietetics is about. Not all of it, but a big part of it. So clearly, as dietitians, you think, well, we're going to be focusing on diet. And that is absolutely true. But as a dietitian, you will also be working on supporting people to improve their physical activity levels. You will also be signposting people to smoking cessation services. If you discover that their alcohol intake is at a level that is increasing health risk, you are going to have a duty to tell them so and to help them, support them to decrease that, or to signpost them to services that will help them become more alcohol aware. Similarly, also, recreational drugs are another area of unhealthy lifestyle that you may come across with some groups of the population that are also have huge impacts on nutritional intake. So there's lots of unhealthy behaviours that we will be involved in. Yes, diet is going to be our main focus, but there are other things that we as dietitians have an impact on. This report by Cancer Research UK and the UK Health Forum looked at obesity-related diseases and suggested that by 2035, these obesity-related diseases could be leading to an additional 2.5 billion indirect NHS and social care costs annually. So bear in mind that this document was published way before COVID-19 appeared. So taking that apart, you still would have all this huge indirect costs. So this is only indirect cost. It's not talking about the direct ones. So the cost to the country, to the economy, but predominantly to people's lives is going to be significant. So there's a lot of health issues that we need to focus on in order to change health outcomes, and behaviour change is going to be a massive part of this. So looking a little bit more recently, the Health Survey for England happens on a regular basis and focuses on different things, and each time it is actually run. And it basically interviews thousands of people and takes measurements from them to get a picture of the health of the nation. So this is just the most recent one, which was taking data from 2017-18. And they found that 68% of men and 60% of women were overweight or obese. So all of the interventions so far to try and decrease the overall prevalence of these conditions has not really worked. They looked at children, so that's up to the age of 16, and found 18% of boys and 13% of girls are obese. So a significant problem. So that doesn't include those that are overweight. Those are just those who are obese. They found that 18% of men and 15% of women currently smoke cigarettes. Now, the good news is that that is something that is continually falling, but very slowly. So we really want to encourage more and more people to give up smoking in order to decrease the profound risks to health through cigarette smoking. They found that 14% of men and 11% of women had untreated high blood pressure. So clearly people who were having their health damaged, their increased risk of stroke and heart disease because they had no idea they had high blood pressure. And it's just one of those things that you don't know you've got. So screening is really important. But weight, body weight, and salt intake, alcohol intake are all really important factors in the development of high blood pressure. So again, something that we're going to be highly involved in. They looked at alcohol consumption and found that 57% of adults drank at levels which put them at a lower risk of alcohol-related harm. And I was quite amused by the way they've worded this, because to me, the key thing is that at least 43% of the adult population are drinking at levels that are putting themselves at harm. So not that far off half of the adult population drink far too much alcohol. There is no safe level, really, of alcohol. The levels that we are given and recommend to people are simply those that will put them at a lower risk, but not no risk. So we've got a real issue in this country with alcohol consumption being at a level that is going to cause huge amounts of harm. And one of the things that's quite interesting about that is that people are tending to drink alcohol at an earlier age. So there's been a study quite recently done on young adults in Bristol area, and a lot of them were drinking alcohol at an unsafe level. But what was really, really disturbing was that a lot of them had fatty liver disease. So they'd already got signs of alcohol causing damage to their livers at a stage that's reversible at that stage, but it will not continue to be if they continue to drink alcohol. So this is a problem that is getting worse and that we can expect to see getting worse and causing more health-related problems in the long term. Another more recent statistics on obesity, physical activity and diet just again gives us a little bit of a picture of the impact of unhealthy behaviours. So we've got over 11,000 hospital admissions that were directly attributable to obesity. So purely because of people being obese, those hospital admissions occurred. 876,000 hospital admissions where obesity was a factor. So that's going to relate to people with diabetes, stroke, cardiovascular disease. And again, don't forget that most of these statistics are not including COVID-19. 67% of adults are considered active, that is, they meet the government recommendations for physical activity, and 47% of children and young people meeting the physical activity recommendations. But again, that means that half of children and young people are not meeting the physical activity recommendations, which are a minimum in order to promote health. So we've got some real concerns there about unhealthy behaviours that many of the adult population and children population are not meeting anywhere near the recommendations. So what do I mean by health-related behaviour change? And behaviour change interventions can be looked at from an individual, household, community or population, which is public health level. So what it really means is abandoning health compromising behaviours like smoking, having a poor diet, being inactive or having sedentary behaviour, alcohol consumption, particularly above the recommendations, use of recreational drugs. And I also put stress in there because actually one of the major causes of time off work across the whole of the UK is stress and mental health related. And that doesn't tend to pick up on diet quite so much. but is an implication for causal point of people eating an unhealthy diet. So stress can have an influence there. So we'll explore that later on in different areas. So adopting and maintaining health enhancing behaviours is what is the behaviour change that we will be looking for. So we'll be looking for people to consume alcohol within safe recommendations, for changes towards a healthy diet, and clearly that's complex. It's not just one change. Moving towards a healthy diet is a complex thing. So we might be looking for people to start with increasing their fruit and veg intake, or decreasing their salt intake, decreasing their fat intake. So that complex change to moving towards a healthy diet is a bit of a journey rather than a one-off thing. We will be encouraging people to become physically active, to at least meet the minimum recommendations that come from the Department of Health. And we will also be looking to encourage better mental health management, better stress management, and more rest when it is required. So all of these things are about abandoning health compromising behaviours and adopting and maintaining health enhancing behaviours. So what do we mean by individual level health behaviour change? And what we're talking about is an action that helps somebody to, it might be somebody with a specific health condition or with an unhealthy behaviour that may be affecting their health. It's not just about one-to-one consultations, and a lot of people think dietetics is all about that, just a one-to-one with a patient or a service user. But it can include our groups, and it can include other methods as well, such as public health interventions. So what the focus is about creating measurable change in a specific person. So whatever intervention we do, is it helping that individual to change something from health damaging to health promoting? Cutting down fat intake, cutting down salt intake, increasing their physical activity level. But these need to be sufficient changes in order to cause a health change. So they may just, somebody who might just decide to cut down their fat intake, but are they doing it, is just changing from semi-skimmed milk to skimmed milk going to be enough? Probably not. So we're looking at changes that are going to be big enough for people to actually see a change in the aim of their treatment, or the aim of the changing in behaviour, i.e. to change weight, to change blood pressure, to decrease risk overall. So it's not just about lifestyle conditions, behaviour change. Behaviour change might be us trying to encourage someone to eat more, for someone who needs nutritional support. It might be supporting someone with celiac disease to better meet the demands of a gluten-free diet. So it's not just about the health conditions that I've been talking about so far. Behaviour change is right across our practice, trying to encourage people to embrace the change that is needed in order to support their health. So on our next session, we're going to talk about models of behaviour change and what that actually means.